talk about heart checks, what do you think involves a comprehensive heart check?
Yes, I think you need to look at the risk factors which lead to heart diseases,
Okay.
heart attack and heart failure, and what is the health of the heart muscle, heart's blood pipe and the valves.
Right.
So normally we do the risk factor profiling right from physical examination. You look at their waist hip ratio,
Right.
look at their body mass index, then calculate their heart rate, blood pressure, and then you look at the physical examination, that
Right.
one part. And then you go to the blood test, you look at their cholesterol levels, blood sugar levels, then you look at their cholesterols.
Right.
Very, very important.
Right.
3 bad cholesterol, LDL, total cholesterol, triglyceride, 1 good cholesterol, that is HDL. Higher the HDL, less chance of heart attack. And then you look at other parameters, kidney function, liver function, and hemoglobin.
Right.
Heart. So these are blood workup. And then in some women and others, you may look even at thyroid
Right.
disorders. And then coming specifically to heart, we do an ECG, echocardiogram. ECG speaks for the electrical activity of the heart. It is not very sensitive. Sensitive means it does not detect all the heart disease. But if it detects, it is very specific. There will be heart disease, but it cannot detect most. In 50% of the people who undergo bypass surgery, ECG is normal. Unfortunately, most people come and tell us, doctor, I don't have a heart disease. Last 5 years, I've done my ECG, all is fine. And they land up with a heart attack. Right? So ECG is good, but not very reliable.
Right.
Then you do an echocardiogram. Echocardiogram is like a sonogram. How you do abdominal scan, we do a heart scan, where you can see the pumping capacity of the heart, any severe narrowing of the blood vessel leading to regional wall motion abnormality, and then are there any valve disorders by birth or related to age.
Right.
Both we could assess. Those who suspect, in whom we suspect blockages, we ask for a new test called CT angiogram.
True.
This is not a regular catheter angiogram. It can be done as an outpatient.
Right.
You need not even meet a cardiologist. Here, it calculates the calcium deposit and the cholesterol deposit in the heart pipe. I've undergone myself. I think it's very important to know that if I can predict my own future risk, I know what precautions I must take. So all of us should subject ourselves to once in 5 years at least. What is it that I need to change? CT angiogram is a very good test to rule out disease. If it says no blocks, 95 to 98% chance there are no blocks. Don't worry about it. But if it says there's a 50% block, 70% block, it's good at detecting block, but not good at quantifying the severity of block.
True.
So today this has also become part of the health check. Advanced heart health check involves a CT angiogram. But any of these are abnormal, then we subject them to regular angiogram or further heart failure therapies and things like that.